Hello and welcome to my channel. In this lecture we'll continue our talk about mastication, and the topic is the neural control of mastication. So let's start. The nervous control of mastication must be a precise one to coordinate jaw movements according to the type of food being ingested. It's carried out in a automatically fashion with little conscious effort, and we become actually aware of this when we bite our tongue or cheek, and this happens before with all of us. A precise neural control is clearly required to execute the movements and complex movements of the jaw. During these movements, the teeth are in close contact, and the elevator muscles can exert very powerful forces. So we have to coordinate the jaw movements with those of the tongue and cheeks and lips to keep replacing the food squeezed out during each phase. Now, in order to achieve this precise control, we need receptors, types of receptors to detect the status of the jaw and the teeth, and also conducting system, which are the nerves, and centers in the central nervous system, which are the brainstem centers under the control of the cortex. So the brain constantly receives information about the state of the participating muscles and joints, and also receives information about the position of the mandible and degree of force being exerted on the teeth and supporting tissues. The information, as mentioned before, comes from numerous muscle spindles in the muscles of mastication and terminate in the trigeminal mesencephalic nucleus. Please refer to the trigeminal lecture in the series. And this is irrespective of the cranial nerve supplying the muscle. So it's important to know that the center receiving this information is the trigeminal mesencephalic nucleus. Now, the receptors are variable. They are present in the capsule and ligaments of the TMJ, temporomandibular joint, and also the associated muscles of mastication. They contain receptors that continuously provide information about the status of the jaw. Numerous unencapsulated endings in the capsule may provide information about the perception of the position of the mandible. Other types of receptors, encapsulated endings in the capsule, are high threshold, rapidly adapting. This is called proprioception, by the way, and they are thought to respond briefly to movements of the joint. Now, this information, sensory information, passes to the trigeminal mesencephalic nucleus via the auriculotemporal nerve and masseteric branches of the mandibular trigeminal nerve. We discussed this before about the branches of the mandibular nerve in previous lectures. Other types of receptors are the free nerve endings, and usually the free nerve endings are called the nociceptors or the pain receptors. The nociceptive neurons send information to the trigeminal spinal nucleus, not the mesencephalic nucleus, the spinal nucleus. So be careful with the unencapsulated and the encapsulated endings and the muscle spindles. They send information to the trigeminal mesencephalic nucleus, while the free nerve endings, which are the pain receptors, send their information to the trigeminal spinal nucleus. Now, this proprioception impulses mechanisms in the TMJ, when they are interrupted by injecting local anesthetic in an experiment, injecting a local anesthetic into the joint cavities, jaw position can no longer be reproduced with any accuracy. The same happens when injecting the lateral pterygoid muscles with a local anesthetic is also inhibited in a similar way. So the knowledge of the jaw position through proprioceptive information derived from the TMJ and the muscles, especially the lateral pterygoid muscle, is crucial to accomplish the accuracy of control of the mastication process or mastication cycle. Also, there are receptors in the periodontal tissues that respond to mechanical forces acting on the teeth. They are of several different types with different physiological responses. Means they are slow adapting and rapidly adapting responses. The sensory processes of these receptors pass to the brainstem via the mandibular and maxillary branches of the trigeminal nerve, on their way also to the mesencephalic nucleus of the trigeminal. Now, these receptors are probably important in regulating the force of muscular contraction during chewing, and also playing a critical role in some jaw reflexes. Now, when studying the pathway of these sensory information, it was discovered that a brainstem center called the central pattern generator in the brainstem, which is receives information from the proprioceptive receptors, and it's under the control of the cerebral cortex. That includes the motor cortex, and the recent investigations suggest that also the part of the brain called the insula. Remember, it's the deep part in the floor of the lateral sulcus. The insula plays an important role in the control and coordination of oral activities, like the transport of food within the mouth, like swallowing, mastication, and these receptors or these mechanisms control the whole feeding mechanism. Now, it's thought that the brainstem mechanisms are involved in initiating and maintaining mastication by detecting the muscle range or controlling the muscle range of contraction. The rate of contraction and force of contraction can be matched to the different foodstuffs we inject. Okay, by receiving sensory information about the texture of food derived from also taste and aroma and previous experience of food. Let's talk about jaw reflexes. There is a jaw reflex, jaw jerk reflex, like the knee jerk and the ankle jerk reflex. It's elicited by a sudden downward movement of the lower jaw, with a brief, which responds with a brief burst of activity in the elevator muscles. The afferent limb of the jaw jerk reflex is from the elevator neuromuscular spindles, and the efferent limb is via the motor neurons in the mandibular nerve. We know that the muscles of mastication are supplied by the mandibular branch of the trigeminal nerve. The jaw jerk reflex may be tested during examination of the patients to investigate the integrity and of the mandibular trigeminal nerve. This is performed by placing a finger on the patient's chin and then tapping the finger sharply with the fingers of the other hand or with a patellar hammer. So it's simple. Sudden downward movement elicits an upward movement of the lower jaw. You can test it on yourself, by the way. Now, there are reflexes called the loading and unloading reflex. Occurs in response to sudden loading and unloading. It's very important reflex because it provides protection that prevents damage to the teeth and their supporting tissues from excess or sudden loading by inhibiting the jaw elevator muscles. An example of the sudden unloading is when a hard substance suddenly gives way. The unexpected removal of resistance could produce very rapid closure of the jaw with tooth contact and damage, but the closure of the jaw is arrested before the teeth make contact. Loading occurs when sudden resistance is unexpectedly met. For example, when you have soft food, or like, for example, like a fruit stone, like a jam, and you find a fruit stone in the jam sandwich, the reflex will inhibit closure to prevent dental damage. Sudden changes to loading are detected by periodontal receptors, which produce swift cessation of contraction of the elevator muscles. The elevator neuromuscular spindles also play a role by stopping firing when the muscle fibers suddenly shorten during the rapid unloading, or when their rapid movement is stopped by contact with a hard object. The reflex safeguards the teeth and their supporting tissues from sudden violent contact or excess load. I hope you got the maximum benefit from this lecture, and thank you very much for watching.